Barbara Forshner has dedicated more than 20 years to the healthcare industry, driven by a personal passion for advocating for the dignity and well-being of seniors. Her journey began when she witnessed the lack of respect her grandfather received in a long-term care facility, an experience that inspired her to become his advocate and ultimately pursue a career focused on improving senior care. For the past 3 years, Barbara has been the director of sales at Brookdale, Hamilton, New Jersey, where she continues to guide families through the challenging process of finding the right senior living community for their loved ones. Her deep industry knowledge, extensive professional network, and compassionate approach have made her a trusted resource and advocate for countless families.
That is true.
That is true. Say all factual. See, I didn't fake.
No, it wasn't embellished.
Everything's real.
It's the truth.
The real deal. So, what was your? I guess let's start with the experience with your grandfather. What kind of how did that go? What kind of alerted you to maybe you weren't really feeling that this was the right thing happening?
So what happened was I didn't really have a lot of experience with any of this, and he had come from New York to visit my mother and wasn't doing well. Went to the doctor, immediately went to the hospital, and then had to go to a nursing home because she could not keep him at home. And we were waiting to get him into somewhere else, so we had to do an interim place. And I would go and visit with my baby at the time, my husband at the time, and there was just no respect. You know, this was a gentleman who might not have had 2 nickels to rub together, but wore a suit every day in the Bronx and was outside chatting with everybody. And now they're like walking into the bathroom when he's there. They're not knocking. We took him to lunch. When we came back, the floor was wet. I said, where should we bring him? Just leave him there. So I was very upset, and you know, this is someone who raised me when I was little, and I was very close to him. So I started to make some calls and found out about the Ombudsman's Office, which is a body that oversees nursing homes and assisted livings. And if there's some kind of egregious complaint or something, you can call. At the time, you could do everything verbally. You didn't need to document anything. And I did report that because I didn't want any other family to experience what we experienced. He wasn't there very long because a bed opened up where we wanted him to go, but unfortunately, we took him to the doctor right before he left, and he passed. Okay. So that was my experience. And then, you know, a few years later, my daughter was going off to college. I had been on the road for years in sales and answered an ad for a nursing home because I decided I needed somewhere to hang my hat and not be out on the road any longer. And that's how I began in a nursing home.
Okay, so that you started off on the outside looking in, so to speak, because you're advocating for your grandfather. Now, once you actually became inside of the industry, I know you learned a lot from that perspective. So what are some of the things you learned, like why would that even occur to me? I mean, to me, that just sounds like awful, right? I mean, is this a common thing in areas, and how do different places approach it? 'Cause I know they're very different personalities between the different locations, right?
So, you know, there's a big difference between a nursing home and an assisted living. And, you know, people older than myself, their thoughts are an assisted living or like a nursing home. They don't really know the difference, the in-between, that you can move to assisted living without necessarily needing medical issues, but no longer want to, you know, cook anymore. You want activities. I always kind of equated it over the years as a cruise without the water. So no matter whether you have dementia or not, it's the same sort of thing. Right. Every community runs very differently. I always think it starts at the top with, in a nursing home, you have an administrator. In an assisted living, you have an executive director. So they have different requirements for that job and licensing. And it begins at the top. So if your leader, like in any business, isn't good at the top, it trickles down. So the attitude, the morale, the taking care of people, there needs to be someone who's making sure those things are happening. And, the family feedback, but, we have to be advocates and walking around and knowing what's happening in your community.
Right, which is really incredible. And I know over the years since you started doing this, there's a lot more options and a lot more things that have happened, right? Because you started this a little while back, and I know just looking around as I drive, I feel like every time I turn around, there's a new facility coming open, and sometimes they have different ways of doing things a little bit, right? So can you tell us a little bit about like what this trend is and what you're seeing in the industry itself?
Well, a lot of things I want to say after COVID went downhill. Right. There was a lot of changeover of management and companies buying existing communities. And that makes a community suffer also because there's a changeover, the staff changeover, the way of managing a building changes. I've been at Brookdale Hamilton for 3 years and in the dementia area for about 10 or 11 years. And, we are, Brookdale Hamilton's the largest senior living company in the United States. We have over 500 buildings. So, they have things structured a different way. We're not a mom-pop operation where things get done different ways. We have to follow protocol. We're on the stock exchange. So there's a lot of different things that have to happen. Even in the way I was trying to print something on my computer the other day and it's blocked because there's all kinds of securities.
Right.
So all of that runs differently. The training in communities like Brookdale, every person that works there's monthly training and they have to go on. It's monitored to make sure that they've completed all that training. So it's an ongoing thing. It might not be the case in a privately owned company. They don't have the funds to provide all of that, or they don't do that. It's
right.
just very different.
So it sounds to me like there's like regulatory obligations that everybody, of course, has to do, but then there's like the company itself and what types of things they do to try to make sure they implement the strategy they feel is best for their clients, right?
Right.
Their patients.
Even, move-ins are different. Paperwork is different. Sometimes people will just... So in assisted living, you don't just come from the hospital and move in. There's paperwork, there's assessments that have to be done before all the medication, prescriptions have to be there. It's different when you're coming from the hospital to a nursing home. You just go, and then right. everything happens later on. But in assisted living, that's not the case. So there's a different path of doing things, and I really do like that we, at Brookdale, there are different people overseeing different things. So for instance, a family comes, I tour them, they're interested. My director of health and wellness goes out and does an assessment, but she doesn't determine whether the person is appropriate or not. It has to be appropriate on both sides. We can care for them and they're appropriate for our community because you have to worry about the other residents as well. But once she does her report, it goes to another layer, our corporate nursing team, and they review it, and they come back, and they're the people who say yay or nay. So we've been almost the past 6 months at 100% occupancy. So we do have occasional, someone moves out, someone passes, and we do take a waiting list, so I have someone to move in right away. But, we're fortunate. It's a great building. Not only is the team wonderful there, but we have great families. And in my 20 years, I've never seen such a bond of family members. They literally support one another. They're there every afternoon, not just to see their family member, their loved one. They're there helping each other. Mm-hmm. And it's sort of, I joke, but I say it's a love fest in the afternoon there because we have a huge atrium when you come in, and this building had a few $1 million renovation 3 years ago when I got there.
I remember I was visiting you guys.
Yes, so I had a networking event and Kurt was there and we didn't even have a floor. They had ripped up the floor. But everyone came to support, the building and me. And all of that together with the team and the staff and the just the family's love for each other and support, it creates a unique situation. I mean, I have two two ladies who found out that they both had children in Boston, and they actually took a ride to Boston together to visit their children. You don't see that very often.
Yeah.
You really don't.
That's really cool.
Yeah. I mean, I've placed home health aides. I've worked in regular assisted living. I've been in the hospital every day as an advocate there. And this is just a very unique building.
Wow.
So, I mean, I used to refer people there before I even came there.
Well, that says a lot about it, right? So
it does. You know, pricing is different in all these different communities as well. So everything plays into it, and you have to sit with the family and figure out their whole journey, because it's not just for the resident moving in, it's for them as well. And that support is a really added benefit. You know, we have a support group, we have another educational academy on dementia monthly. So all of that helps, and they have to be emotionally ready. That's a big thing also.
All right, you ready for the next one?
Yep.
I'm gonna have a drink of water. That's right.
Okay.
All right, here we go. You ready?
Yes.
Okay. Okay, well, that's really awesome. So I have a couple questions for you. One is like, this is one of the things where like it's triggered usually by an event where somebody has to go to a care facility, right? And at least what I've seen, unfortunately, although we try as advisors to get people to plan ahead of time, many times they don't. So can you give us an idea of the scenario of somebody who's kind of planned ahead and said, okay, well, how does that look? Making sure you go to the right facility, you're on the waiting list, whatever it is. And then the other one is where somebody hasn't really done it. So let's start off with the one hopefully more people are doing. Let's say I've planned. Now, you mentioned a waiting list. Let's say that's my preferred place to go. Mm-hmm. But now when the time comes, maybe you can't let me in. You're at 100%, right? So,
okay,
so kind of how does this whole thing work when the time actually comes, even if you planned it all out and kind of know where you're going?
A good question. So I always tell people, don't wait till crisis. Make sure you have ideas ahead of time and you can have a plan B. And Mercer County is also very unique. My professional partners out in the community, we all work together in making sure that people are getting to the right place, because my place might not be the right one for your mother, but my friend in Princeton, her building is a better choice. So we're really good in networking with one another and letting each other know availability and what we can do. So it starts kind of with that. The other thing is, if someone has planned ahead, because you need to be the power of attorney financially and medically. If that's done, that's great, because that's a gift to your children to have that done. But also, you can't move into my community, especially it's an all dementia community. We're small, we only have 49 residents, but everyone has either early onset dementia or late stage. So someone has to be the medical power of attorney. So again, if someone's sitting with me in that discovery time, I can give them the names of several attorneys out in the field that I would use myself or have used, and direct them. That's their first call after they leave me. Mm-hmm. They need to go make sure, because especially with dementia, if you haven't done that early on, or at that point, you're not going to be able to get your loved one to sign off. The lawyer will not sign off on that. And then you have to go down the guardianship route, which is not an easy route, and it takes time. So someone who's really prepared, they did the powers of attorney ahead of time. Financially, they know where all the assets are. Because we're such a large company, we work with another body that will get you a bridge loan practically overnight, and Brookdale will pay the interest for a while, and you can pay it off right away, because we don't want that to stop you from moving your loved one in when they need the care, because you're waiting to sell the house. Mm-hmm. So they have all different means in place to be able to assist. Someone who doesn't have all of this, I tell them to get a pad of paper out, and I start giving them the names of lawyers, and, you know, I'm connected with a lot of home care companies, so maybe we need that in the interim until we get all our ducks in a row and you can actually move in. So there's so many, it helps to have somebody recommend. I always give choice, because I want them to feel comfortable with whoever they're choosing for this. So there's a lot of pieces to the puzzle that have to be done.
Oh, no, and I agree 100%. And I think, unfortunately, not enough people are planning far enough ahead and making sure these things are kind of in place. And the more we can make people aware that it actually, I always like to think of it as like, well, once you set it up, you can just kind of relax a little bit because at least you know it's done. Even if it's way into the future, at least you have some kind of structure. And even when you set up the structure, the other thing is somebody, well, if I set it up, what if something changes? You can always tweak it and modify it. It's very simple to make adjustments. Like maybe you have a medical power of attorney and then you want to change that person, you can just swap them out, or financial.
You should review that every few years.
Absolutely.
Who you chose 10 years ago is not who you want to do that now.
That happens quite a bit for many reasons. They may not be aligned or available, or whatever the case may be. So, yeah, you definitely any legal stuff you set up, you need to have a periodic review of those things, and that's key, really.
Right. Another thing is, people have long-term care insurance, which we accept, but they don't really know what they bought years ago.
Right.
Because if they didn't review it with their children and some agent came and sold them some, that happened to my parents actually. They thought they had long-term care insurance, but they did not. They had some kind of thing for respite care, but they didn't need that. Respite care is like a short-term stay.
Right.
They could afford to pay for that.
Right.
So they didn't really have long-term care insurance.
Oh, boy.
I happen to have a really great policy that I don't even know if they write anymore, but it would cover a nursing home, assisted living, or home care. Very expensive, has to be maintained. If you're one payment late or a day late, they cancel you out. So all of these things. So the perfect person is someone has the power of attorney. Maybe they have long-term care insurance, so financial, no burden on the family of trying to figure out how they're going to pay for this.
Right.
Because these things are costly, if they don't have a house to sell and funds. But the other thing is that at Brookdale, if you spend down for 2 years privately and have no more assets, you're eligible to stay on Medicaid. So it's not like it was when my grandparents were in New York. If you were on Medicaid, you were in a horrible place.
Right.
I mean, really, you wouldn't even want to walk in the door. But now you get to stay where you've moved in as long as you're following the steps and get your Medicaid in order, and you get to stay. So there's a lot of preparation, and I would say most people that you would think don't even have a power of attorney.
Right, so that's an important point. So if somebody is worried about, well, financially, am I going to be able to stay there long enough? But as long as you can pay for it sounds like in your case, as long as you can pay for at least the 2 years, then you can continue to stay there. So at least now you have at least a rough number, like the costs are always changing, but at least you kind of know, hey, based on today's number, here's what I need to set aside, right? And here's what I need to have available, whether it's equity in my home or my assets or whatever the case may be, wherever it's coming from, a long-term care insurance, at least I know I can cover that period of time.
But again, that's not something most people have. It's expensive. It's much less expensive if you start it earlier.
Sure.
Like any insurance. And it's costly.
Right.
So that wouldn't be probably the scenario for most of the people.
Right. But yeah, so I agree 100%. I mean, that's a conversation any advisor has with their clients, is like I think the conversation now is more about like, how do you pay for long-term care? And care insurance might be part of that, or there may be other assets they already have that they can just set aside and say, okay, this will cover that. The more wealthy people, of course, have many more options they can use.
Right.
But the conversation needs to happen, and sometimes it's a multi-generational conversation, because if the parents can't afford it, the children may not want the parents moving in with them, right? So sometimes you have to have, and sometimes the children are financially better off than the parents in some cases, where they can help and they can support and they can subsidize it, so to speak. And oftentimes parents, because there's a lot of pride, right? They're like, oh, I can't really do that, but maybe your children can help you in some way, shape, or form. And that's always it's a family conversation, I guess. What I'm trying to say.
It's tough because, that generation didn't speak about finances. Sure. And, my own experience in the past 2 weeks, my mom passed away. And, I know when my dad passed away 15 years ago, no one had discussed anything. So, kind of dragged her down here 2 years ago and made her do all that documentation because my sister and I did not want to make those choices for her. So luckily we did all of that, and now we're just kind of chasing down banks because my mother was of the generation wherever someone gave you a free toaster, you had an account. We've got CDs all over the place, and we're trying to pull that all together, and we've got it down to 4 banks because it was a lot more before that, and I made her change that, So we're trying to do that. But even something simple like that, someone's got to be able to know this. Otherwise, you're a needle in a haystack and boxes of paperwork and trying to figure out what's happening. So the more you can prepare with your family, the better you're going to be. Everyone's going to be better off. It's not as stressful.
Agree. So somebody's getting started to go on this journey. As you pointed out, there are many different types of facilities, and then there's many different kinds of matches. Do you want to like touch on what are some conversations they should have about that?
There are people who are care managers, and they have their own companies, and what they do is they can do the homework for you after they know all the facts and schedule appointments for you in places they think will be acceptable to you or can meet the person's needs. There are companies that do that as well. I always think the private ones work a little better because they're more in tune to the different buildings and what they are actually like than someone who gives you 12 places to go and it all sort of blends together. They're not really all the right place. So you can do that, speak to other people, your senior centers, I do events there and speak there, and we have health fairs where people can ask questions. So they're always a good source for recommendation. And, you have to be specific to what the person's issues are. There's a lot of Alzheimer's associations that know the communities. And, this morning someone from a care management company called me. We went over the scenario of someone they're working with that they just met. So they will actually bring them to my community, and they've kind of told them all about it ahead of time, and then they come, and then I talk about what the value is in my building.
Great. Okay. Ready for number 3?
Sure.
Sure. Don't sound so excited.
Sure.
I will just continue with that, obviously. Okay?
Okay.
All right, here we go. Okay, yeah, so there's a couple, we've been touching on like there's different kinds of scenarios, different kinds of people. So what are some of the categories of things that people might be looking for in a care facility, and how do you what are some of the factors you look at or facilities look at when they're trying to really align a potential patient client to their facility, and what are some things where you might say, oh, that might be better over here as opposed to my facilities? So there's any factors that sometimes come into play for that?
I'll give you an example. So my building is a 1-story building. Everyone has dementia. The building is secured, not within the building. So our residents, if you have someone who is mobile and kind of active, they can meander around wherever they want all day so they don't feel trapped.
Right.
A lot of dementia units are up on the 3rd floor with closed door, and they can't get out. Okay, so for someone who's pretty mobile, that doesn't work because they feel like they're imprisoned. Mm-hmm. Years ago I worked somewhere where, small dementia unit, 20 residents, and they put the wallpaper that looks like bookshelves, with books in it, like a library, mm-hmm. to try to distract them from the door, but it didn't work. People were like banging on the door.
Good, it didn't work.
It didn't work all day long.
Okay.
If you have a couple and they need to stay together, and one is in the beginning of dementia and the other is good, they might move into an assisted living that has, a larger apartment that can accommodate, because that's regulation too, size. And they might move in together to start, but they know that when the other person advances, there is a dementia unit to move them into, and the husband can visit his wife.
Oh, that's great.
So you have to kind of figure out what they're looking for, and each one has different flavor. Some people want the big, huge building with all the chandeliers and everything, and that's great. But if you have somebody who's kind of pleasantly confused, I want to say,
Right.
then that might be too overwhelming for them, and they might end up staying in their room because they came in okay and they didn't really need to have someone overseeing them, but now they're kind of lost in space and it's not really doing what it needs to do. So you have to kind of know where the person is in their journey, and find the right place that's going to be able to grow with them.
Okay. So once somebody picks a facility and now they're in the facility, so what are things that you said the family members come in and they kind of work with? So what are some good ways family members can be in partnership with the facility and the patient to make things run even better for the experience for the person who might be living there? What are some things that the families do to help out?
Right. So our building is unique because it's small. And, we always have some kind of activity in the afternoon. It could be music, it could be trivia in the morning, or exercise. When the families come, they like to participate. So like I have a DJ I bring in monthly at this point, and music's the last thing to go in the brain. So the residents love it, even the person who's not verbal. If you play You Are My Sunshine or Sweet Caroline, they sing every word.
That's amazing.
So when the families come, when we have the DJ, for the family members, they feel like they're on a date with their husband or wife again. They even give me playlists before the DJ comes. And, we just had an event in September that was Fall in Love Again. So fall in love in the fall. And the theme was falling in love. So the residents their family members brought pictures of their weddings. They told me their wedding songs, and I had the DJ play this. And, we had a gentleman who doesn't talk that much, but you know what? He spoke about his wedding song for days afterwards because he danced with his wife. And so you have to know your residents. When they move in, most communities will do kind of a background history so they can match them with other residents, or just know what the interests are. And, when we have in the afternoon an ice cream social or anything like that, or an ice cream truck, the family members help. They go get the ice cream for the other people. They know who likes ice cream. It's kind of crazy, but they do know a lot about the other residents, and they'll help with that. They'll help the activities. Enrichment team pass the ice cream out, or the cupcakes, or, and socialize and talk. We have another lady who likes to have coffee in the afternoon. One of the wives of one of the other residents will go and make her a cup of coffee. So that's how they participate,
Well, that's really awesome. I know that usually when we think of these types of facilities, we're thinking about the older people out there. But I know in some cases, people are much younger. So can you tell us a little bit about any experiences you've had with younger people end up needing to go into these types of facilities? Sure. And why people really should not wait, because it can happen much earlier than we realize. And so can you give us some ideas about how that works? And
for instance, I want to say most people are in that mid kind of 80 range, but
right.
People are living longer. They're right. coming in later. Mm-hmm. And then you've got people who have early onset dementia, let's say, in their right. 60s. So for Brookdale, there's an age cap. They don't want to have people who are younger because that might not be beneficial to them. But it's individual. We have a gentleman who's in his 60s who came into the community, and the other places that he had gone to were not providing the dignity and space he needed, but he was a musician and plays the piano. So the first thing that happened when he came in was we sat him at the piano and he played, and all the residents sat around and sang with him playing. So you just have to find what will spark something in that person and make them feel comfortable. So you do that by speaking to them and the person who has brought them to our community, because they can tell us the history of things that maybe that person can't vocalize now, but it's still there.
Yeah.
You can bring it out.
Okay. Yeah, because you mentioned you have a minimum age, right? So if somebody's younger, I don't know, I hear about people in accidents, and there's other reasons like that, or medical issues.
My community might not.
But it doesn't
be the
happen
place.
for you.
No, not for us. Maybe in another community.
But there's some that might address those kinds of things. Is what I'm trying to think. 'Cause I've been just talking to the community. I've been surprised. Hear about people in their 40s and things that are in like they're in these care facilities, and you're like,
yeah.
oh wow, I didn't even realize.
Yeah, it's very sad.
Yeah.
It's sad all around for everybody.
Right. So there are places that can kind of handle that and cater a little bit more to somebody who's maybe younger than would be normal. So
yeah, I mean, dementia is a different place. So somewhere that's not a dementia facility, just a regular assisted living, they will have people who are younger.
Okay.
But you want them to have people to bond with as well. And you don't need a lot. As long as you have one pal, you're good.
Okay.
Because then they kind of schlep around together all day long.
That's good. Yeah, having at least one person to connect with is always a good thing. So what about family that's like maybe not nearby? Because you have people that are coming in. Is there ways for people that are maybe live across the country who would love to be with their parents, but not practical? So how do they connect with them a little better?
So they can do FaceTime.
Okay.
They can do that, but we also have over 500 buildings. So if someone is here and then the family is relocating, they can relocate the person and have them closer.
Oh.
So they can move to another building in Florida if that's what they want to do. Otherwise, there are, as I said, these care management companies. And we have one resident whose brother does not live in the area, and they've hired the care management team. So the person from that team comes in weekly and is like their family and takes care of them, takes them out, maybe takes them to doctor's appointments. So you can there's nothing you can't find. I had someone come from Florida, and the daughter was just concerned about flying on the plane with her mom alone. And, we have a care management company I work with a lot. And she got on the plane. She went and got the lady and brought her back here by plane to our building to move in. Wow. So you can find someone to do everything. Another lady wanted grandma to come to the bar mitzvah, but was worried about what was going to happen. That same company, I believe, got her, picked her up. We sent several outfits in case something happened so that it wouldn't interrupt the festivities. And she had a companion with her the whole day, so the family didn't have to worry about grandma.
Oh, that's incredible. So there's a lot more services than we might think about there, right?
Yeah, until you need them, you don't know about them.
Right. That's amazing.
Yeah.
Yeah. So we have a little more time on the last one. So what do you want to cover in the last area? What area you want to make sure we get into there?
That it's important they do their homework and look for places before the time comes.
Okay. We'll talk about that.
Kind of have it in their back pocket.
Sure. Absolutely. All right. You ready?
Yes.
Okay, Barbara. So the key here, I think, of course, we've been talking is that the earlier you plan, the better. So how do we get people to understand that, and then more importantly, how to execute and put that plan in place? So what are some things we can do as professionals or even just as family members to encourage our family to do this?
So I think senior centers is a great start. And I think most of the people in Mercer County who are in healthcare do different programming in senior centers because it's an opportunity to bring flower arranging or whatever games or things you do with the seniors. But you get a chance to talk about your services and kind of let them know what's available to them. People talk to each other, and with the internet, they're always looking things up. So, I always encourage them finding a few places and visiting them so they see the good, the bad, and the ugly, and they know what is acceptable to them for themselves, because what their friend might like might not be what they like. So it's never really too early to kind of know what you might need. And, your financial planner, your lawyer, your accountant, those are all good resources also. I'm sure with, your clients, you kind of tell them what they need to do and the overall picture. And the more we can encourage that, the better and the easier the journey is going to be for everybody. So it's not easy to get them to do it, and there's a lot of hand-holding. So when you're dealing with a family, you need to kind of know, is this going to be a good lawyer for them, or are they going to need the guy in the one office with not a whole team or the big team? it's like a doctor. You got to really like the person who's helping you as well and trust them.
So let's do an A/B scenario. So give me a scenario where somebody came in like where they kind of had a plan together, an A/B plan, so to speak. Another one like crisis management type thing. So let's give them a sense of the difference, like how something flows when it's planned, and maybe how something might flow, even though there's a lot of professionals kind of help in those situations, like how that sometimes is very disruptive. I know that. So
Right.
you want to give us the two scenarios and how they compare?
So when it's planned, it's kind of an easy process because we send the nurse right out, we get the approval, I guide them through the paperwork process, and we get everything together really quickly. The only thing that holds things up sometimes is waiting for their primary doctor to do the paperwork that we need. But I always encourage the family, like, I can't badger somebody, but it's your doctor. You badger them or go get it and bring it to me, and then we'll move you in as quickly as possible. The person who doesn't have anything, you start with the power of attorney and you just make a timeline for them of what they need to go and do. And do the best possible thing. There are temporary Band-Aids. Let's say things can't get done that quickly, then I would refer them to some home health companies so that they have somebody to help them at home until we actually get all these pieces in place. So That's kind of the difference.
Right. And then, of course, I have to find the way to fund it, right? So some of the ways they end up funding these things, so you have two scenarios I'm seeing is one where three scenarios. One where they can fully fund it somehow through long-term care or the equivalent assets, house of sale of house, et cetera. Then you probably have some who have partial funding, like they might be able to do it for a little while, but maybe not necessarily the entire time that's necessary. And how do you work that? And then the last one, they don't really have a whole lot to work with.
So they might have to gather the family together and see if the family will supplement.
Okay.
Talk about veterans benefits. There are other benefits out there that they might not know about. Because we're a large company, we have a list of companies that have a partnership with us where I can give them a permanent discount, like someone who worked when I started, since we're near the hospital, I called this part of our company to make sure the hospital was on that list because a lot of employees from the hospital might be bringing their loved ones to us. Then they can get a discount. They might not be for our community, so I might refer them over to another community that maybe can do that for them. Might have better incentives, or they have a lot of availability, and sometimes when places have a lot of availability, they can do more things.
So from the company standpoint, I know there's a couple of different structures out there. Can you kind of go over, like, just from a payment structure, like, so when people come to a facility, there's different types of facilities, of course. So, and there's also different ways people potentially pay for the services. So can you give us an idea of the different ways people may pay?
So for us, it's a monthly.
Okay.
You're getting billed monthly. So you're not signing a lease, you're signing an agreement.
Okay.
At any time, you can give 30 days notice and you're out. Other communities might have a different policy. I think it's very individual with the different communities, what their policies are in terms of how payment is. Ours is automatic withdrawal. They give us the ability to do that, and the billing is monthly. Somewhere else, they might have to walk in with a check every month.
Right,
that's kind of old school. But I'm sure there's still places that do that as well.
It sounds to me like, and I know one thing in the past, because this is what happened to my mother-in-law, like she had like a buy-in to get to the facility.
So that's a different kind of community. That's a CCR where you do buy-in, and then they have a nursing home and an assisted living, and it's a different process.
Well, she ended up moving out of that, and I know we weren't directly involved. It was my wife's sister that handled it, so I don't know the details of this, unfortunately, but I know. Let's just say there was a little friction on how the transfer was because they didn't stay in that ecosphere. They had to move actually to your facility where you were working at the time.
At the time, okay.
A long time ago.
Yeah.
But they weren't connected. So I know, however, that move happened. I know there were some issues with, like, because they put a lot of money into this one facility and they had to move it over. Is that as common as it was back then?
No, because there's not as many CCRs around.
Okay.
That's a different model.
Right.
And, you kind of have to decide who is going to be in charge.
Right.
And, I do remember your mother-in-law well. So it's very individual. It really is. But, the funds from one community is not going to go to another
Right,
community.
of course not. Yeah.
Like, even if you've paid a year in somewhere and your 2-year spend down,
Right.
and then you decide to move, well, you start all over again.
Right.
It doesn't help that you spent a year of money somewhere and now you don't want to stay there for the 2 years.
Right.
So that's where people get in a trap also.
So the planning is really critical, but I keep hearing what you're describing is most of them are, once you commit, it's pretty much a monthly number, even though it's a pretty high number. You kind of know, okay, here's what I have to pay. So you have a pretty good idea of what your commitment is going to be, even if it's a large number, which I think is, personally, I think that's better, because now if you do have flexibility and you do move to Florida, like, okay, well, we're going to transfer facilities, and we just...
Right, the rates might be different in another state than, our building, but, and another thing, like with our community, we're all-inclusive pricing, so other places have levels of care,
Okay.
so you pay for the apartment and then the level. That's not the case where I am. It's a flat amount. There might be 1 or 2 exceptions to things,
Okay.
but basically you know what you're going to be paying monthly, and there's an increase annually.
Okay.
So they have to kind of put that into the equation too, that there will be an increase next year.
So it sounds like they need to make sure they know all the components of the pricing, not just maybe what the apartment is and where they're living, but what does it cost for the food and what other services.
Well, that's all included.
In your case, but
In
not
mine.
in all. I'm talking about like overall facilities. Just know what the other costs
The
might
food
be.
is included in most
Oh,
places.
okay.
It's more care related or medication management. Things like that might be different.
Okay. Does it matter as far as any relationship with like hospitals, like who can like serve your community, or does it matter? Is it the person, the doctor themselves? Like, because I know sometimes, like let's say something happens, they need to go to a hospital for a reason, right? Let's say
Right.
they can't. An incident occurs where they need to be directed to the hospital. So is there some place they typically go because of your location?
They usually go to the closest hospital
Okay.
for a 911 call,
Right.
and the EMTs kind of decide if somebody has to go to a different place.
Okay.
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 They can say where they prefer, but if something happens and you're in Hamilton, you're going to go to the hospital around the corner.
Right.
You're not going to wait to drive you down Route 1 to Princeton.
Right.
It's just not, it doesn't happen that way.
Yeah, it doesn't. Well, that makes a lot of sense. Yeah. So, I mean, we have a few more minutes left. You want to give us some like summarization of like what advice you give to people as far as to get the right fit, find the right place, and then once you're in there, to get the best result for everybody that's involved?
I think you need to do your homework. You need to talk to other people who've had this with their loved ones as well. And you always have to be your own advocate, for your family, for yourself. You kind of learn that over the years with your own doctor's appointments. You need to ask questions. You can't just accept what people tell you. You need to question it, because the doctor's just a doctor. Doesn't mean he knows every single thing. I had months where I was trying to find out something for myself, and it took 10 months until I finally figured out what it was. The doctors were not directing me correctly. So you really have to ask questions. I'm not going to say be your own doctor on the internet, but because that's
don't
not
go too far.
No, I think you just need to question things.
Right.
If someone tells you you need to do this or take that, maybe get another opinion as well. It's always good to have a second set of eyes, and people are more knowledgeable than you think from their own experiences. So they might, when you're telling them your story, it might make them think of something that they experienced, and they can kind of help you too. We all need a little help here and there. So.
Agree.
Yeah.
Well, this has been awesome, Barbara. I always enjoy having you on the show.
Thank you.
You've been listening to Master Your Finances. Have a wonderful day.
Bye.